Good afternoon. Welcome to Beyond the Headlines. I'm Mitch Pugh, Executive Editor with the Post and Courier. Just a reminder today that Beyond the Headlines is a program that we do every week, taking you behind the scenes of the headlines and news that are happening in South Carolina this week. And we'll, dive a little bit deeper, talk a little bit about how we're reporting on the story and answer a lot of your questions. So I'm joined today by Lauren Sausser, who is our health editor. And thank you all for joining us at what is probably your lunch hour today. Lauren and I are going to talk a little bit about COVID-19, which has become, once again, a very prominent news story and threat in South Carolina. And so we'll answer your questions, talk about some of the things that are happening and what we might be looking forward to in the future. Before we do that, I just want to do a few housekeeping things. Several folks have sent in questions. We'll get to a lot of those here shortly. If you have a question while we're talking, if you scroll down to the bottom of the screen, there is a Q&A function. You can open that up, ask your question there, and we'll get to as many of those as we possibly can before we get off today. We try to keep these to about a half an hour to respect your time. A lot of questions came in today, so we might go a little bit over that, but we'll try to keep it as close as we can to 30 minutes. When we're done, you'll get an email with a recording of this presentation. So if you didn't make it and are seeing this later, this is your recording. The rest of you can share that out if you'd like to other folks that may have missed it. Well, you'll also get some more information sent to you about the stories that we've been working on, links, contact information for myself and for Lauren, should you have additional follow-up questions. Always happy to answer those. Well, Lauren, let's kind of dive right in. Obviously, sure. A few months ago, we all thought maybe we were coming to the end of this. We might be having a normal school year, might be able to start living our lives normally again. But a couple things have sort of come together to get in the way of that. The Delta variant and South Carolina's low vaccination rates. Can you maybe start by just giving us a lay of the land? Where do we stand right now? What's your take on where we are and where we're headed over these next few weeks?
Okay. Well, thanks for having me. There is certainly a lot to talk about today. We are in the middle of our third surge of the pandemic, and we are still, if you think of each surge as sort of a mountain on a bar graph, we're definitely still going uphill, and we can't see at this point or know at this point where we're going to peak. So if you recall, we had a surge last summer. It was in July. We had another one in the winter. I think it got really bad mid-January. I think that's when it peaked, maybe towards the end of January. The January surge was worse than the July 2020 surge. I don't know what this one's going to look like. Based on the way we're mapping it on our COVID dashboard, we're on a really steep incline right now. So I don't know where this is going to top out. I know that DHEC is reporting thousands of new cases every single day. That's concerning because a few months ago, few weeks ago, it feels like we were really low. I mean, there were days when there were no cases in Charleston County. And I guess if I've learned anything in the past 18 months of this pandemic, it's that, I've become real hesitant to make predictions about when it's going to end or where we're going. And anyway, I can definitely say that we're surging again. So that's where we are.
So I know there's been a lot of reporting nationally about this. We reported a lot about it in the Post and Courier. Can you tell us a little bit about who's the vast majority of those being infected, and talk to us a little bit about if you are vaccinated, what that means for you?
Sure. There are the vast majority of people who are coming down with COVID right now are not vaccinated. The vaccines have been available to everyone who is 12 years old and older for months. They're easily accessible, but we still have more than 2 million people in the state who haven't been vaccinated, who are eligible to be vaccinated and have not been yet. So they're the ones who are mainly coming down with COVID right now. There have been breakthrough cases. I know y'all have heard about those, but they are much, much rarer than the cases among unvaccinated people. the age range of people who are getting COVID right now is really across the board. There are a lot more children coming down with COVID right now than did last year. Young children are not eligible yet for the vaccine. And the Delta variant, it seems to be, if not more dangerous, at least more transmissible. So we're seeing more cases among children. They're not necessarily, most of them, the vast majority of them are not getting very sick. We're seeing a lot of young adults getting COVID right now. The age range that DHEC breaks, a lot of stuff down into age ranges, and they're particularly focused on this 20 to 24-year-old age group because a huge proportion of adults that fall into that category are not vaccinated for a variety of reasons. But so we're seeing more young people in the hospital than we saw last year, but really people of all age ranges are getting it right now.
Well, you mentioned that we're seeing more of these younger folks in the hospital. I think, when you think back to last summer, a lot of what we heard from public health officials was that if you were younger and healthy, you were likely not to get as severe of a case. You might get sick, but you might not be in the hospital or face, something that's fatal. That seems to be changing with the Delta variant. Can you talk a little bit about what's happening and what the difference is between what the disease that we experienced last summer and what we're seeing now?
I will say that it still holds true that if you were young and you get COVID, it is still unlikely that you're going to get very sick from it. And one of the reasons we saw so many older patients in the hospital last year was because they are the most vulnerable among us, generally. But now this year, a lot of those people are vaccinated, and they're just not getting as sick as they were last year, to the point where they need hospitalization. Because like I said, this younger age group is not getting vaccinated to the point that they should be, we're seeing more of them in the hospital. It seems the Delta variant is very, very contagious. It appears to be more contagious. I've heard people refer to it as plain COVID or regular COVID, whatever variant, the original variant we were dealing with last year apparently was not as contagious as this one. So if you were unvaccinated, it's easier to catch it this year. We were all unvaccinated last summer, but we were all also last summer working from home a lot more. Obviously, a lot of us were wearing masks last summer. That's happening less this year. Anyway, the point is that if you are young and you catch COVID, you probably are not going to end up in the hospital. But what I will say is that it's happening every day, all the time, to young people who have no prior underlying health conditions, and you cannot predict who it's going to happen to. And this variant of COVID is more contagious, so you're more likely to catch it, if that makes sense.
It does. Well, let's dive into some reader questions. And the first one I want to start with is pretty close to what you were just talking about. And it comes from Charlotte Kennerly. And she said she's that 19-year-old relative that refuses to get the vaccine, feels there's not enough knowledge about the long-term effects. Reasoning is that the older generation not going to be here, but he will. Many of his friends feel the same. These are a large part of the unvaccinated. How can they be convinced to get the COVID vaccination? That's her question. I
think that the brightest minds in the country and in South Carolina are trying to figure that question out. And I don't know the answer. I think, different people are going to respond to different information. I think, there's so much out there from my perspective that I'm reading and writing and reporting that I find it hard to believe that people say there's not enough information out there. I feel like there's so much information out there. There's so much history out there too about the efficacy of vaccines, not just this one, but a variety of vaccines over the course of history. But I think, driving home the fact that more people are ending up in the hospital this year could be effective. I think that there's also I think that there's like you could frame it as like, if you're not going to do it for yourself, do it for people who really cannot get vaccinated. It's not just about protecting yourself. It's about protecting, people who are more vulnerable than you. I have 2 little kids, neither of them qualify for the vaccine yet. And I'm, my anxiety is high right now because we're about to go back into school, and there will be school outbreaks, and anyway, it's unfortunate that we're here, but
Yeah.
but I think another thing, if you were trying to convince people to get the vaccine, it probably works better on an individual level than it does, talking to someone one-on-one is probably more beneficial than, trying to talk to them on Facebook or sending them links to articles. Although certainly share ours, there's lots of good information, but yeah, there's not a clear-cut answer, and I think people are still trying to figure that out.
Yeah. I've heard a lot of public health officials say that if we want to go back to our pre-COVID lives, the best thing we can do is get vaccinated.
Oh yeah.
I think a lot of us want to do that. So let's go to the opposite end of the spectrum. A question from Ann Smith. What should vaccinated people who are over the age of 60 be doing to protect themselves right now?
That's a good question. Both my parents are over 60. My dad has cancer. And so this is something that I think about a lot. I think that you should start wearing your mask again when you go out. I think that you should make sure that you're spending time with other adults who are vaccinated. If you have grandchildren who are in school, who are under the age of 12 and don't qualify, you might want to be more cautious. You might want to make sure that, if those grandchildren are showing any symptoms, that they're tested. I have already gotten my children tested this summer. They were negative. But I would generally just be more cautious. It's like you said at the beginning of the conversation, earlier this summer, it felt so good and it felt so normal, and it really felt like we were getting back to where we were. And unfortunately now we've regressed. And I think that if you want to be cautious and you want to make sure that you don't contract this disease, that you need to probably start implementing some of the measures that we were using to not get sick, last year and earlier this year. I don't like wearing masks, but I'm wearing them.
Yeah. And I don't think any of us really want to go back to that at all,
Right.
Certainly. I got a question from Vicki Lynch that wants to know about COVID testing. She mentioned that she traveled, over the summer. The airline required her to get tested. Her test was negative. But she was wondering, do the numbers really reflect, are we seeing as many people being tested? What are the testing numbers tell us
Sure.
about?
More people are definitely being testing is low right now. Generally, it's been low all summer because it wasn't circulating. I was pulling the stats from DHEC today for our daily story, and the percent positive of COVID tests right now in South Carolina is 16.2. That's really, really high. Mainly, that's a reflection of the fact that people who have symptoms are the ones who are going to get tested. Testing is not very widespread. It's not as widespread as it was last winter. And so as more people, I imagine that percent positive is going to go down as more people start getting tests. It's also possible to administer at-home tests to yourself now. So I don't think that these numbers reflect that. You can kind of self-diagnose now, although those tests are very hard to find in stores. They kind of fly off the shelves as soon as they're available. But yeah, mainly that high percent positive reflects the fact that, we're not doing as much testing as we were.
Sure. Well, I'm going to a question that I know has been in the news here just recently. In that, this comes from Holly Kemp, and she said she's heard of young women who want to start a family in the future, not wanting to get vaccinated for the fear that it's going to have some impact on their ability to get pregnant later in life. Is there any research around that? How legitimate of a concern is this?
It is something that certainly has been talked about. And so I think it's a good question, but what every health organization has definitively concluded is that there is no evidence that it has any impact on fertility issues for men or women, young or of childbearing age. There was the American College of Obstetricians and Gynecologists. I call it ACOG, but I think that's what it stands for. Earlier this year, when it came to vaccinating pregnant women who are already pregnant, their guidance, I believe, was that the vaccine should be made available so that people can make a choice. That guidance has evolved to say unequivocally that people who are pregnant, who are breastfeeding, should be vaccinated. We have a lot of data now to back up the safety of this. My sister is a doctor here in town. She was pregnant this spring. She was vaccinated. It is a good idea to do. And and even if you're not pregnant, it's not going to impact your fertility in the future.
Gotcha. So another thing that's been in the news lately is this concept of needing a third shot, a booster shot, especially for those who are seniors, 65 or older, who have underlying health conditions. Leah Chase was asking about that. What do we know about the booster shot? What can we expect? What's the latest?
That's actually what I'm writing about today. So if you want to pick up Sunday's paper, there's going to be an article about that. The FDA actually said yesterday that it seems like they are going to start approving booster shots for people who are immunocompromised, who might have weaker immune systems than you and me. It does not appear that people who are otherwise healthy, that it would help very much. There's also some confusion about, there's actually a difference between what a booster is and what just a new vaccine is. A booster would really just be a third shot of the vaccines that are already available. I think what's more likely in the future, probably not this fall, but next year, is that we're just going to need maybe a new vaccine, sort of like we get a new flu vaccine every year. That won't be a yearly booster. That'll just be a vaccine that covers a different strain of the virus.
Makes sense. I'm going to go to the live Q&A portion of our questions. So just a reminder to everybody, if you go down to the bottom of your screen, there's a Q&A button. You can click that and ask a question. We'll get to as many of those as we can. Got several in here already. Ann Smith wants to know, and I remember this. So I think we all remember in the early days of COVID, wiping down cans that we got at the grocery store, washing our hands, wiping down surfaces, and then guidance kind of evolved over time. But do we need to be concerned about packages or things that come in the mail or other objects like that? What's the latest guidance on that?
I don't think you do. I think this is a respiratory thing, and that's why masks are being pushed so much, because obviously we breathe through our nose and our mouth. But no, I don't think you need to be wiping down packages. That's been dispelled. But I mean, certainly be clean. I mean, use hand sanitizer, wash your hands, but I don't think you won't catch COVID through a package in the mail.
I mean, to that point, someone in my family recently had a cold for the first time in a long time, because we finally got out and we're seeing other people. And so it's not just COVID that sort of thing helps for. So.
MUSC right now, the Children's Hospital, is seeing crazy cases of it's a respiratory illness called RSV, and it's for that reason. And usually it's acting like a winter cold season right now. That's what it's like in the hospital, even though we're in the middle of summer, because we were all protecting ourselves really well, and then all of a sudden we weren't, and it gave a chance for other bugs to spread.
Makes sense. I'm gonna go back to the questions that came in ahead of time, and this came from someone who's traveling from Georgia, Robin Hall Franklin. I don't know if she's on the call today, but thank you for participating all the way from Georgia. They're traveling for a week of vacation on Pawleys Island later this month. They're fully vaccinated, but obviously watching the numbers creep up, and wanted to know what precautions health experts would recommend they take while enjoying our beautiful state.
Well, welcome in advance. You should be perfectly fine on the beach. I think a beach vacation sounds great. I would love a beach vacation right now. If you're eating out, I would wear a mask in a restaurant, when you're walking around, or if you're shopping indoors. I socially distance from people when possible. But I still think that you should be able to enjoy the vacation. I would honestly just I would wear masks when you're indoors.
Makes sense. Kind of on that same vein, a reader, Basso, is asking, I canceled a trip involving 2 flights due to Delta variant of COVID-19. This person is 69 and fully vaccinated. Is that smart, or are they being too cautious?
That is a great question, because I have some trips that I really, really want to plan. And I am not booking flights until the last minute, because it's just hard to say what's going to happen. Yeah, is that too cautious? I don't know. Without knowing anything about your health status, it's hard to say. If you're fully vaccinated, even if you caught the Delta variant, you might get sick, but it is very, very unlikely that you would require hospitalization. The thing is, you'd still have to quarantine. So that obviously would be an inconvenience to your daily life, especially if you ended up getting sick on vacation somewhere. So I think this is such a personal decision, but I guess this is sort of more, if you can't relax on your vacation, then what's the point of the vacation? I mean, if I wouldn't go if it's not going to be enjoyable.
So kind of along those lines, Sue Coggins, a reader, was asking kind of a similar question. She's planning a trip to Tanzania in October. What's the guidance on traveling overseas? What are we hearing from health officials and others?
So I have traveled overseas during the pandemic. It required me to get tested before I left. 5 days before I left, the country that I was visiting required me to have a test while I was there. I don't know what the restrictions are for that in Tanzania. You probably are going to have to show some proof of vaccination. If you're 72 and you have underlying health conditions, you may very well qualify for one of these boosters if the FDA starts doing this soon, which it sounds like it's going to do. I don't know. I don't know if you'll need one. Chances are you produced really good antibodies when you were fully vaccinated with that Moderna vaccine. And so I don't know what's happening on the ground in Tanzania. It's hard to say, and especially it's hard to say 6 months out. I have been fooled by this virus time and time again when it comes to making long-term plans, and it's just really hard to say. But short answer, you might need a booster depending on your health conditions. And it sounds like if you need one and you qualify, you will be able to get one soon.
So this next question sort of gets into the politics of the thing, or some of the local rules and regulations that are out there. But Anaya Cohen is asking about schools, and especially elementary school children, wanting to know, is it possible for school superintendents to require masking? I think that answer probably depends on where you sit on this issue. But can you talk a little bit about what you know about what local school districts and superintendents can and can't do, and then also maybe what the public health guidance is for parents who are trying to make that decision?
Sure. Well, it definitely depends where you are. There was if you've been reading any of our school related COVID coverage, you have heard about this proviso that the legislature passed that prohibits school districts from spending any state money to enforce a mandate. Different people interpret that differently, but the way that the legislature and the governor are interpreting it is that school districts cannot impose mask mandates without violating the language of this proviso. Some school districts Charleston specifically has said that its hands are tied, but that it strongly recommends children and staff wear masks in school. I am sending my child to school with a mask unequivocally. But not everybody in her classroom, I'm sure, will be masked. I still think it's going to provide some level of protection for her. She doesn't love wearing them, but she wore them all last year, and it's something we're going to be doing again for sure. So it's for the most part, it's going to be an individual parent decision in South Carolina, and something that I will be really interested to see. I don't know if the school districts are collecting data on this or not, or planning to, but if it's voluntary and strongly recommended, how many kids will be masked? I'll be interested to see those numbers.
And as a parent, Lauren and I know as a parent that we can send our kids to school with a mask. And then are they going to keep it on, right? I mean, that's what's interesting about this, is because I think even if you're a parent who wants their child masked once they head to school, if the school districts really can't enforce it, it's going to be interesting to see. It's going to be really about the discipline of the kid in some ways.
Well, my daughter is only 5, and I haven't taught her the concept of free will yet, so I hope she keeps it on.
Yeah, I wish I would have stuck with that. Mine's 17. He's sort of learned that part of it. But I don't want to get too lighthearted here, and I want to address this. So we have Anthony asked several questions, and Anthony's obviously struggling with, believing fully in some of the public health guidance that's out there, asking a lot about, the vaccine and its effectiveness and how serious this disease is. But the one question I thought is interesting that I wanted to see if you could weigh in on is, he believes that there's things like nutrition supplements, other drugs that you can take and use that will be just as effective as what he calls an experimental vaccine. Can you talk about that? I mean, that's obviously he's not alone.
Yeah.
What can you say about that perspective from a public health and scientific, what we know in terms of the public health guidance and the science behind it?
Okay, so I am not a scientist. It's my natural inclination as a reporter to ask questions. So I'm going to tread lightly here and point you in the right direction if I can't satisfy your question. But there are very effective drugs that can treat COVID if you get sick. They're called NyQuil and Robitussin and Hall's cough drops. For the vast majority of people, those over-the-counter medications work really well to treat the symptoms. They're not going to cure the virus. The virus is going to run its course, but they will help you feel better when you're sick. I know of no drugs that can prevent you from getting COVID. The vaccine, I know Anthony used the word experimental. There were obviously clinical trials before the FDA granted emergency use authorization, but I will also say that since emergency use authorization was issued, that millions and millions and millions and millions of adults have gotten this vaccine. We have so much more data on its effectiveness and its safety than we had 6 months ago. And so I think now scientists and public health experts are even more convinced than before, simply because we have this enormous amount of information that they work. Now, I am not a scientist or an epidemiologist, and I understand how vaccines work, sort of at a very simple level. But what proves it to me that they work, or sort of what drives home to me that they're effective, is that when you look at the people who are hospitalized, which is what everyone worries about, right? I mean, I'd hate to get COVID and I'd hate to quarantine for 10 days, but really what people are worried about is getting hospitalized and dying. And when you look at the people who are hospitalized and dying from the vaccine right now, they are almost all they're all unvaccinated, almost all of them. Last year, obviously, the vaccines weren't available. Everyone who died was unvaccinated. When you look at 18 months worth of data of people who have been hospitalized and people who have died in this state and in every other state in the country, you know, more than 99% of them were unvaccinated. So to me, that doesn't explain how the vaccine works, but it explains that it does work. It illustrates that it does work. So I hope that answers your question.
Thanks, Lauren. Speaking of sort of knowledge base and reputable sources where people can go find information, I have a reader saying that they, you know, Dr. Scott Gottlieb seems to be somebody that they find reputable. Who do you look to? Who do you pay attention to? What do you read?
Yeah,
to feel like you know what's happening and you're getting
yeah.
your information from a reputable source.
I think Scott Gottlieb is very reputable. For those of you who don't know, he was FDA commissioner for a time under President Trump, and he has really emerged on social media as a voice of reason. I use Twitter a lot. Journalists use Twitter a lot, but to follow people. There are, I should put a list together because it's hard to say off the top of my head, but
Yeah.
I read a variety of news sources, and I read a variety of primary sources too. You know, I think that the healthcare reporters at the New York Times are really good. I think the Atlantic is producing really, really good health journalism right now. Andy Slavitt, who he did healthcare stuff under Obama and did it briefly for Trump in the for Biden in the White House, is really good at talking about what's happening in language that people can understand. These are people that I follow on Twitter, but I would trust DHEC's website. DHEC publishes a slew of South Carolina specific information every single day. And we reporters at the newspaper, every day in the paper and online, we provide a small snapshot of the data that DHEC is publishing. We have sort of picked and tried to condense what we think people care about the most. But if you really want to dig into those numbers, I would just Google DHEC COVID. I think it's called COVID dashboard. And every single day, right around lunchtime, I just pulled the numbers before I hopped on here. They are publishing lots and lots of numbers.
Yeah, and then the MUSC website has also been very good source for locally. If you want to find out what's happening here in Charleston, they've got a pretty good alert system and data there as well. I'm gonna do one more question. I know we're at 12:32, but I think this one's important. This comes from Sherry Marat. Is DHEC keeping records of our vaccines? If we lose our card, we lose the information that proves we've been vaccinated. Is there some place we can go for replacement? Do you know what's happening?
That's a good question. And I think they are, although I'm going to look into this a little bit. But like I mentioned earlier, I've been reporting the story on booster shots. And I was talking to a local pharmacist here in Charleston who said there's been, intense interest in from some people who want to get that third shot, and that she's had people come into her pharmacy and basically lie, saying that they were unvaccinated, and her pharmacists are able to check some sort of database and sort of weed out these people who are clearly not telling the truth. So I am thinking that there must be something. I don't know if that database is I assume it's something that DHEC is keeping, although I can look into this. But a lost vaccine card, that's a question I have not thought of. I keep mine, for what it's worth, inside my passport, and I keep a photo of it on my phone for easy reference. But
did the same thing. Took a picture of my phone, keep it in a very safe place.
Yeah. So. But to your point, I think there is a database of who is vaccinated and not, or just who is vaccinated.
Well, sounds like you're giving us a good story idea, Sherry. So thank you for asking that question. We'll follow up on that and try to answer that in the newspaper.
Yeah, for sure. I mean, certainly it's going to happen to someone.
Yeah. All right, well, so I think we're up against the end of our time here. Thank you so much for coming out and hearing more about obviously what's an important topic, something that's affecting all of our lives right now as we try to figure out when normal might be back. So as we said before, this Q&A has been recorded. You'll receive it in an email sometime later today after we wrap up. Also in that email will be information how to contact Lauren, how to contact myself, links to stories and our COVID dashboard and other things to help you navigate through this. Got some great story ideas from you all today. Thank you. I know many of you are subscribers or donors to our investigative fund. Thank you so much for doing that. We couldn't do this work without you. If you're not a subscriber, of course, we'd love you to consider becoming one at postoncourier.com/subscribe. Until then, we'll be back next week. I think next week's topic will be back to school. So I'm sure COVID-19 will come up again in that conversation, along with some other topics. Again, thank you for taking your time this afternoon. We appreciate it. We appreciate your subscription if you are a subscriber, and have a great rest of your Thursday. Thanks.
Few newspapers do the kind of investigative work that we do here at the Post and Courier. We spend months looking at issues and trying to understand them. I've done stories about greed and betrayal at a large grocery store here, the Piggly Wiggly chain. We've exposed corruption at the State House. We've done stories that helped our readers understand their worlds a little better, allowing them to make the kinds of decisions that they need to make to live their lives a little better.